Health age is indexed through 4 different inputs, quantifying 16 years of metabolic and lifestyles data using both VMT and TDA models. Number 1387, VMT Sharp 724, TDA Sharp 008, October 11, 2025. Gerald C. EclaireMD Foundation. Category: Metabolism and Longevity. Mission statement: I write these medical papers not for fame or recognition, since I have already lived a long and successful life, though not always a healthy one. My purpose now is to share what I have learned about health, disease, and medicine, so that others can better understand their own conditions, prevent illness, and live longer, healthier lives. Preface: Today, I heard the news that President Trump's recent health report showed his chronological age as 79, and his health age as 64, meaning he is 15 years younger in physiological terms. In comparison, based on my developed custom medical AI software's calculations, my real age is 78.5, and my health age is 66.9, which means I'm 11.6 years younger. While President Trump's age advantage appears numerically larger, the underlying calculation methods are likely very different. Institutional health exams typically rely on brief physical assessments, blood panels, and BMI-based projections without detailed behavioral data, such as detailed lifestyles. Even as the U.S. President, it is doubtful that he would have a dedicated system or personnel, continuously recording and computing his daily lifestyle details. In contrast, my health age is derived from a comprehensive 10-factor model that includes 4 biomarkers: weight, glucose, blood pressure, and lipids, and 6 lifestyle details: food quantity and nutrition quality, walking exercise, water hydration, sleep hours and quality, stress, triggers and emotional states, and daily life routines. These combined variables represent both input behaviors and recovery capacity, providing an accurate measurement of metabolic state and health age. Such a combined model captures not only internal physiology, but also the long-term impact of consistent habits. For example, dietary discipline and daily walking directly shape glucose control, while adequate sleep and effective stress management stabilize the nervous and hormonal systems. These effects accumulate across years, making the calculated health age a dynamic reflection of both biological and behavioral resilience. Therefore, while President Trump's 15-year age advantage is most likely based on limited and static data, my 11.6-year difference is grounded in continuous quantitative tracking over 16 years, and several million detailed data points, offering a far more accurate and actionable view of personal aging. In summary, both health age results show successful aging management, but the scope, depth, and reliability of the underlying data determine whose health age truly reflects sustainable long-term wellness. These insights and discussions provide the scientific foundation for this health article. Introduction. The dataset includes one output strain of age ratio, defined as the health age index equals 100 times health age divided by real age, and the following 4 inputs. 1. Biomarkers, includes body weight, 30%, glucose EAG, 48%, blood pressure, 14%, and lipids, 8%, reflects overall metabolic outcomes across these 4 key biological parameters. 2. Diet exercise, includes food, 50%, walking steps, 40%, and hydration, 10%, represents controllable behaviors that regulate metabolism and glucose utilization. 3. Mind-body, includes sleep, 45%, stress, 40%, and daily routines, 15%, supports recovery, hormonal balance, and long-term systemic stability. 4. Overall Metabolism Index, OMI, represents a combined metabolic variable defined as the OMI index value equals 0.30 times the biomarker, plus 0.45 times diet exer plus 0.15 times mind-body, plus 0.10 times the OMI score. 2 analytical methods are used for this study: the Viscoplastic Energy Model, VMT, and Topological Geometry, TDA. The following section describes the TDA findings, while the VMT results are discussed separately. TDA analysis method, results, and interpretations. Research method. A topological data analysis, TDA, approach was applied to reveal geometric relationships among 4 normalized stressors: biome, diet exer, mind, body, and OMI, and 1 output strain, the health age ratio, 100 times health age divided by real age. Each stressor is a dimensionless index representing biological, behavioral, and holistic aspects of metabolic health. 1. All collected and calculated data during from 2010 to 2025 were standardized using Z-score normalization. 2. Principal component analysis, PCA, was then used to approximate the topological manifold in 2 dimensions, PC1 and PC2. 3. Each year corresponds to 1 node on his 2D manifold. The spatial proximity between nodes indicates metabolic similarity, while long distances reflect systemic change. The overall geometry and node clustering describe the evolution of metabolic balance over time. TDA results. 3 radar charts for 2010, 2017, and 2025 were selected, and their 2D diagrams show a clear contraction in geometric area, reflecting a steady reduction in total system stress. Radar charts polygon areas, using polar method. 2010, 5.18, 100%. 2017, 1.04, 20.1%. 2025, 0.92, 17.8%. Using 2010 as the 100% baseline, the area decreased to 20.1% in 2017 and further to 17.8% in 2025. This 82.2% overall reduction in system stress confirms the same pattern observed in the TDA projection, a continuous, geometric contraction and progressive stabilization of the metabolic system. This radar chart polygon areas decreased from 5.18, 2010, to 1.04, 2017, and then to 0.92, 2025, representing a 5.6 times contraction in system energy and stress magnitude, confirming the same manifold stabilization trend observed in the TDA scatter diagram. TDA projection results, ASCII format, year PC1 PC2 age, H per R, 2010 4.96 minus 0.31 114, 2011 3.75 minus 0.08 113, 2012 2.52 0.15 112, 2013 1.58 0.39 114, 2014 0.12 0.25 103, 2015 minus 0.73 0.0693, 2016 minus 0.92 0.1190, 2017 minus 1.01 0.1089, 2018 minus 1.04 0.1189, 2019 minus 1.01 0.0990, 2020 minus 1.21 0.1286, 2021 minus 1.27 0.0286, 2022 minus 1.42 minus 0.2486, 2023 minus 1.41 minus 0.2487, 2024 minus 1.47 minus 0.2385, 2025 minus 1.44 minus 0.2885. Explanation, illustration. PC1 shows a continuous leftward movement from plus 4.96, 2010, to around minus 1.44, 2025, which means the overall topological structure of health data shifted toward a stable low energy region. PC2 fluctuates slightly between 0.31 in 2010 through plus 0.39 in 2013, then stabilizes near zero by 2019, and afterward, indicating smoother equilibrium in multidimensional balance. Age, health per real, declined steadily from 114, older health age, in 2010, to 85, younger health age, in 2025, showing roughly a from 25 to 30, precisely 29, year improvement in physiological condition. In topological geometry, this continuous, leftward contraction and PC2 stabilization illustrate manifold compression, meaning the health system has reduced variability and achieved internal coherence. Visual interpretation. Visually, the scatter diagrams show a gradual migration of data points from the upper right region, widely dispersed data representing an unbalanced and unhealthy metabolic state, toward the lower left region, a tight, compact cluster representing a balanced and healthy state. This geometric shift illustrates the topological contraction of the health manifold, signifying improved internal coherence, metabolic stability, and sustained recovery over time. Explanation. In the 3D TDA plot, early years, from 2010 to 2013, are located at higher, more scattered coordinates, indicating larger variability among stressors. In the 2D TDA projection, later years, from 2015 to 2025, cluster tightly in the lower left zone, showing stabilized topology and reduced metabolic fluctuation. The vertical color gradient bar in above diagram represents age, H per R, the health age to real age ratio. On the right scatter plot, the vertical color bar clearly shows the scale. Yellow-green tones correspond to higher age, H per R, values, around 110-115, indicating older or less healthy years, for example, from 2010 to 2013. Blue-purple tones represent lower age, H per R, values, around from 85 to 90, indicating younger or healthier years, for example, from 2019 to 2025. The projection shows a continuous leftward shift of points from right, from 2010 to 2013, to left, from 2015 to 2025, indicating a geometric contraction of the health topology toward a low energy, stable state. The color gradient corresponds to decreasing health age, H per R, reflecting physiological rejuvenation and systemic recovery. Interpretations. Two regimes emerge. Regime A, from 2010 to 2013, right side cluster, with large PC1 values, showing high biomarker and behavioral stress, and older health ages, approximately 114. Regime B, from 2014 to 2025, left side compact cluster with reduced stress levels. Biome is approximately equal to 0.9, diet per exer, is approximately equal to 0.65, mind per body, is approximately equal to 0.55, and younger health ages, approximately from 85 to 90. This contraction of the topological manifold signifies reduced internal fluctuation, stronger interparameter coherence, and transition from a dispersed, unstable state to a stable, low-energy configuration. In topological terms, the health manifold has become smoother and more connected, meaning the elimination of irregular holes, and stabilization of systemic behavior. TDA summary. The TDA analysis demonstrates a 16-year transformation from a high-stress, irregular topology to a compact and resilient structure, quantitatively matching the from 25 to 30-year improvement in functional health age, observed through longitudinal tracking. VMT analysis section to be added by author. VMT analysis method, results, and interpretations. Research method. VMT results. I used the same 16-year dataset of strain versus 4 stresses and conducted a viscoplastic energy analysis. The following conclusive patterns have appeared. VMT cumulative energy. From 2010 to 2015, 85.8%, 100%. From 2016 to 2017, 10.6%, 12.4%. From 2018 to 2025, 3.6%, 4.2%. In comparison with the TDA geometric area size, the actual numerical values are not identical. However, the 3 overall patterns are highly similar. Both methods reveal a strong and significant declining trend of total energy level, or geometric shape and size, reflecting progressive metabolic recovery and system stabilization over time. Radar charts polygon areas, using polar method. 2010, 5.18, 100%. 2017, 1.04, 20.1%. 2025, 0.92, 17.8%. Another noticeable pattern is the very high 4 correlation coefficients between the strain of age, health, real, and the 4 stresses, indicating that healthy aging, and the 4 influential factors follow the same direction, from worse, high values, to better, low values. These strong correlations suggest that, as the body's biological functions improve, the corresponding stress levels from biomarkers, diet, exercise, and mind-body conditions all move synchronously toward equilibrium. In practical terms, this means that aging reversal and health rejuvenation occur, not through isolated improvements in one domain, but through coherent and system-wide adaptation. Data correlations. Biomarker, 94%. Diet, exercise, 89%. Mind-body, 96%. Overall Me, 92%. VMT energy. The total VMT energy is 661.45, with the following 4 VMT energy contribution ratios. Biomarker, 32.5%. Diet, exercise, 23.6%. Mind-body, 19.7%. Overall Me, 24.3%. The Overall Metabolism Index, OMI, represents a combined metabolic variable derived from 4 biomarker elements and 6 lifestyle details, each assigned specific weights. OMI index value is 0.30 times biomarker, 0.45 times diet, exercise, 0.15 times mind-body, 0.10 times OMI score. In summary, approximately 40% of the total influence is biomarkers, 32.5 overall. Me 24.3 times 0.3 is 39.8, comes from biomarker-based for clinical diagnosis variables, while the remaining 60% originates from lifestyle management, factors that lie within the patient's own daily control. This finding highlights that long-term health recovery depends more on individual patients' responsibility, through diet, exercise, sleep, and stress balance, than on laboratory results, or medical prescriptions from our healthcare system alone. VMT conclusions. My past 16 years of collected medical and health records have been entirely medication-free, managed exclusively through data-driven lifestyle discipline, guided by the Viscoplastic Medicine Theory, VMT, and AI-based self-tracking. In contrast, my stroke study, number 1366, VMT Sharp 707, September 25, 2025, revealed that 91%, prior 20 years, of stroke-related damages were associated with medication-dependent pathophysiological conditions, such as diabetes, hypertension, and lipid imbalance, while only 9%, recent 16 years, were related to lifestyle-originated causes. These two findings together show a critical distinction. Clinical medicine plays a dominant role in treating acute crises, whereas lifestyle management governs long-term health preservation and recovery. Combined summary: modern healthcare continues to emphasize the importance of laboratory, biomarkers, and pharmacological treatments, partly because these are supported by existing medical infrastructures. Yet lifestyle behaviors, which depend on patients' own daily discipline, are also measurable and provide equally, if not more, valuable, quantitative insight into disease prevention and metabolic regulation. While clinical treatments remain essential for managing acute conditions, a stronger focus on daily lifestyle behavior and patient engagement can meaningfully reduce medication dependency and promote sustainable long-term health. This balanced approach honors both scientific rigor and personal accountability. Interestingly, the TDA geometric findings reinforce this VMT understanding. The radar chart polygon area contraction from 5.18, 2010, to 0.92, 2025, an 82% geometric reduction, shows that roughly 80% of system stabilization originates from lifestyle-driven improvements in diet, exercise, and mind-body balance, while about 20% results from biomarker adaptation. Together, both VMT and TDA analyses consistently demonstrate that sustainable health recovery is powered primarily by informed, proactive self-management, supported, not replaced, by medical guidance alone. The contrast between my 9% VMT energy contribution on stroke during the recent medication-free 16 years, compared with the 91% VMT energy contribution on stroke during the earlier, medication-heavy 20 years, presents a powerful comparison. Furthermore, my TDA analysis clearly demonstrates that self-managed lifestyle discipline accounts for about 80% of my total health recovery and long-term physiological stabilization in this longevity study. The 3-level visual presentation, from data tables through 3 radar charts, and 2 TDA scatter plots to final VMT, strain stress energy curves, creates a convincing storyline. Each visual layer progressively compresses complexity, illustrating the health system's stabilization from multiple mathematical, physical, and engineering perspectives. The inclusion of the zigzag real stress strain energy curves instead of smoothed ones adds realism and authenticity to the data narrative. Disclaimer: this content is provided for educational reference only, and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.